Namaste Bitiya, Hamesha Khush Raho Bitiya. A very good morning to you all. Myself, JV and Dr. Ravi Jain, Associate Professor and HOD, Department of Practice of Medicine in Faculty of Homeopathic Science at JAYOTI VIDYAPEETH Women's University, Jaipur. In this lecture, we are going to discuss about the general physical examination. Whenever a patient is coming to you in the OPD, what are the various things that you need to see in a patient who is coming to us in the OPD? General physical examination is a broad topic that includes lots and lots of things. But we are going to discuss only few things in this particular lecture, that what are the various things that you need to observe in a patient who is coming to us, and just by the method of observation, what are the things that you can assess by looking at these features. So, the common things, whenever a patient is coming to us, the patient is suffering from one or the other disease condition, then we have to observe all these 9 points. I will be discussing about the 9 points in this lecture, that from the time when the patient is entering your chamber and is coming to you, what are the things you need to observe in a patient and to reach at a particular diagnosis. So, first of all, we need to check for the facial expression of a patient. Whenever a patient is coming to us, the patient will be in pain, will be in agony. By looking at the facial expression, you can know a lot about a patient. So, number one, we have to look at the facial expression. There are certain diseases in which the facial expression are totally lost, like Parkinson's disease. Whenever a patient is in pain, then you can just, by looking at the patient, you can notice that this particular patient is in pain or agony, or the patient is having any problem, he is tense, stressed. So, first of all, the first thing that we need to observe in a patient is the facial expression. Second thing that you need to observe is the complexion. Some patients are of dark complexion, some patients are of fair complexion. Complexion is important in various diseases that are related to the pigmentation, that is hypopigmentation disorder or hyperpigmentation disorder. Disorders related to the melanin pigment and various other marks. So, first of all, you need to observe the facial expression of the patient, then you have to observe for the complexion of the patient. The complexion will tell you a lot about other disease conditions. Third, you have to notice the state of clothing. Whenever a patient is coming to you, then you have to check for whether the patient is properly dressed, not properly dressed. Does the patient is having any kind of soiling? Is there any vomitus? Or the patient is stained with stool or urine? So you have to check for the state of clothing in a patient. First of all, you have seen the facial expression, then you have checked for the complexion of the patient, whether light complexion, dark complexion. Then we have to check for the clothing, how the patient is dressed. A patient who is not mentally stable will not be dressed properly. A patient who is properly dressed might be having certain other problems. So we have to look for the state of the clothing, whether the patient's clothes are stained, not stained, whether properly dressed, not dressed. Then we have to check for the state of consciousness of a patient, whether the patient who is coming to us is conscious or unconscious. If the patient is coming to us directly, then the patient might be conscious, and if someone is taking the patient to us, then the patient may be unconscious. Another thing we have to notice for a conscious patient is whether the patient is cooperative or not cooperative. When you are asking the questions about the disease of the patient, if the patient is properly interacting with you, it's telling you each and everything, that means the patient is properly conscious and is cooperating with you, is telling you each and everything related to the disease condition. The second thing that appears in a conscious patient is the patient is not responsive to you. You are asking constantly various things from the patient and the patient is not responding properly. That is the level of consciousness and also the mental state. Sometimes small children are coming to you. The mental state you have to observe, whether the patient is calm, the patient is hyperactive. In various disorders like fever, the patient becomes dull. The patient is not responding properly. Whereas in case of hyperactivity disorders of the children, the patient is very much hyperactive. He will sit here, he will sit there, he will just throw the things of your chamber. That is the mental state you have to observe. So by looking or by understanding the mental state of the patient, we can know a lot about the disease condition of the patient. Next is the posture or gait. This is a very important thing. As soon as the patient enters your chamber, then you have to look for the posture and gait of the patient. How the patient is standing, that is the posture, and how the patient is walking while coming to you, that is gait. This tells us a lot about the locomotor disorders. If a person is having any kind of locomotor disorders like osteoarthritis, like rheumatoid arthritis, the gait will be disturbed. If there is any balancing abnormality, if there is any muscular dystrophy, then this can be understood by looking at the gait. By looking at the posture of the patient, if the patient is standing properly erect or the patient is stooping, that gives an idea about the posture, and this can tell a lot about the disease condition for which the patient is coming. By looking at all these points, we can, even without asking the patient about the disease condition, we can know a lot about the patient condition. So we have to look at the facial expression one, then complexion of the patient, then we have to look at the state of clothing, then mental status or consciousness. Then we have to look at the posture and gait. These things have to be looked simultaneously, all of them together. We are just discussing the points that we need to discuss. Then abnormal sound and speech. Sometimes the patient, when the patient is entering your chamber, there are various abnormal sound heard with the patient. Like in case of respiratory diseases, there are wheezes or rales or rhonchi that can be heard in the patient. There can be rattling sound while breathing in the patient. That can direct you towards the respiratory disorder even before the patient is telling you. So we have to listen for the abnormal sounds and speech. Sometimes the patient is having stammering speech, sometimes the patient is not even responding to you. All these speech and abnormal sound we have to keep into mind. So abnormal sound not only relates to the abnormal sound of the respiratory system, but also relates to the other systems of the body, that we will be discussing one by one while we are doing the examination of the systemic examination. Then we have to check for the smell or odor of the patient. When the patient has come to you, has sit in front of you, and then you are asking various things from the patient. The first thing, whenever the patient is coming and sitting in front of you, then you have to check for the various odors from the body. Like we have discussed the state of clothing. Sometimes the patient's clothes may be soiled and that can produce abnormal odor. Sometimes the smell or odor can be because of the perspiration, excessive perspiration or smelly perspiration, offensive odor perspiration, because we have certain medicines for different types of, different varieties of perspiration and smell and odor. So we have to check for the odor. Sometimes halitosis or offensive odor can be experienced from the mouth of the patient. Then we have to look at the build or physique of the patient. Build or physique means whether the patient is properly nourished or undernourished, whether the patient is well nourished, malnourished. This we come to know about the build or physique of the patient. Build, well built, weak, lean and thin. This we have to see whether the patient is underweight, malnourished, that we have to note for. Then we have to check for the height and weight of the patient. This helps in noting the BMI. By noting the BMI, BMI is weight divided by height in meters square. By this we can understand the height BMI and thus calculate the build or physique of the patient. So this was the summary about the general physical examination. In next lecture we will be discussing more about these things in detail. So this was all for today. Thank you very much. Have a good day.